Well, hello, and welcome to my case study for a toddler for Well Baby Check. So again, the next age group we're going to be talking about is the toddler group. So the toddler comes in for their 2-year-old checkup to the clinic. And as you can see from the picture, 2-year-olds are a little hesitant sometimes and sometimes very negative people. So the look on this 2-year-old's face is, what are you going to do to me? And this 2-year-old also has a little stethoscope. So you're thinking the 2-year-old likes to pretend, they like to play, they like to do what they see their parents or caregivers doing, so pretending to talk on the phone and so forth. When the 2-year-old comes in to the well baby visit at the clinic, you're looking at the history, number one. And the history for this toddler is healthy, no chronic illnesses, no acute illnesses. The immunizations of this 2-year-old are up to date. We're looking at diet. What is this toddler eating? Well, toddlers are on whole milk up until 2 years old. And this toddler is getting 16 ounces a day with a variety of other foods. The 2-year-old is sleeping 12 hours a night and is still taking one nap. Development. This baby or toddler is running, kicking a ball, scribbling, building a tower of blocks, and using push-pull toys, and likes to pretend. The vital signs for this 24-month-old or 2-year-old are 100 beats per minute for the heart rate and a respiratory rate of 22. When you are starting to examine a toddler, this healthcare provider looks like they're almost teasing this 2-year-old, but you want to always think about your approach to the toddler. They're a little bit uncertain, especially at the 15 and 18-month-old. They'll be clinging to their parents. They won't be able to sit on the chair like this big girl, 2-year-old. They'll be clinging to their parents. Usually by 2 years old, they've gotten over some of those fears, and they may be able to sit on a chair or sit on an exam table. But you do want that parent, again, because we are fostering family-centered care, we do want that parent being able to be calming to the child. Usually the child will be sitting on the parent's or caregiver's lap when you approach them. So growth and development. So again, we are going to, at every well baby check, we're going to be making sure this baby is growing on a good curve. And again, the age is at the top of the chart here. So you find 24 months, and the height or length is 36.5 inches. So you follow 36.5 over here and follow it across. And this child to the 90th percentile for height. So again, they're taller than 90% of the other 2-year-olds their age. And this baby's weight is 12.2 kilograms. So again, you find the 24 months and follow the 12.2 kilograms, and this child's at the 50th percentile. You follow that line across and see that it's at the 50th percentile. Again, the development, we're going to do the history and possibly have the child do some things in the clinic to see what they can do. We're always going to be referring to some set of guidelines, such as the Denver Developmental Test. And at 24 months, we know that this age child should be doing things as the parents described that this 2-year-old is doing. Feeding a doll, pretending, fine motor skills, building a tower of cubes. Language. Many toddlers are saying a lot of words, about 50 words exactly, at 2 years old. They'll start putting 2 words together, like mommy go, juice please, those kind of things. They'll point to their body parts. You'll say, where's your nose? And they'll point. Where are your ears? And they'll point. They love picture books. So being able to read to them and have them point out things. As long as 2-year-olds are starting to talk, starting to say some words, starting to put two of those words together, that is appropriate development. Again, remember that not all 2-year-olds are going to achieve the same skills at the same time, but they do achieve them in the same order. So they'll start babbling before they start saying a word, before they start putting two words together, and so forth. Gross motor, as this baby's doing, kicking a ball and running. So again, you look at the age, top of this Denver chart and find 24 months, and then follow that down. And the child should be doing all the skills in all the categories to the right of that line. If the baby is doing things to the, excuse me, the baby should be doing all the things to the left of that line. I'm thinking in a physical assessment world where it's backwards. The baby should be doing everything to the left of that line if you draw it down, because this is 2 months, 4 months, 6 months, and so forth. If the baby is doing things to the right of this line, then they are just advanced. Sign them up for Harvard. Next is immunizations. All babies are going to get their immunizations on a certain schedule. And if they do not have any delays, then they should be on time. So 24 months old, we know that this baby does have all of their immunizations up to this point. So we find 2 years old and follow it down, and there's no vaccines except the influenza. So this baby will get an influenza vaccine every year. The other things that we do check at about this toddler age is we're checking for lead poisoning. So it's not necessarily a blood test, but it is a questionnaire. We ask parents and caregivers to see if the child is at risk for lead. If they do have a positive screen, then we do draw their blood and test for lead exposure. The other assessment that we need to do in the toddler age is to check for anemia, specifically iron deficiency anemia, because a lot of babies will be drinking too much milk, because remember their first 12 months, that's all they drank, was milk, was formula. So then they switch after 12 months to whole milk. So a lot of toddlers are just addicted to milk and they don't get enough iron and nutrients from food. So we always check for anemia, check their hemoglobin at the toddler age. So the child is healthy, has a regular 2-year-old visit, receives their immunizations, but the parent has a lot of questions at this age. Again, because 2-year-olds are very negative people, they're very egocentric. The world is about them. That is their development. So you can't hold it against them. But a lot of parents get frustrated with 2-year-olds' behavior, and it has been termed the terrible twos. This parent has a question. My daughter doesn't share, and she hits other children sometimes. What should I do to discipline her? Well, what will the pediatric nurse respond to this parent about these concerns? Well, there's a lot of tips that you can give parents to help them with these terrible twos. And when the child hits, you want to tell the parent to tell the child no hitting. Toddlers, remember, do engage in what we call parallel play. So they will be playing next to other toddlers, but they will not be likely to share their toys yet. Once I was at a conference and they were talking about how you can help explain the concept of sharing to parents who don't have a pediatric background. And they said it's just like if you get a brand new car and your best friend says to you, "Hey, that's a great car. Can I borrow it for 6 months because I really like that car?" Would you just hand over your keys? Well, these toys that the child is playing with, especially a 2-year-old, are their prized possessions. And they think that if they're gone, they may never see them again. So It's very hard concept of sharing, so we don't expect 2-year-olds to really be able to understand how to do this, and it's okay. So we try and teach parents about distraction and getting the child involved in something else. Let's say they are involved in something that they necessarily shouldn't be. We want to try and distract them and give them something else to be interested in, and then kind of take away something. Kind of avoid that child getting upset and that temper tantrum. Definitely, as parents of 2-year-olds, you want to tell them to stay calm. The more upset you get, the more you raise your voice, the more excited and angry you get, the more difficult it is for the child to be able to calm down. Remember, toddlers are filled with egocentrism and negativism. A lot of times they'll say no just because. You want to, if they are doing a behavior such as having a temper tantrum, you can just not look at the child and give them direct eye contact, but stay close to them to make sure that they are staying safe. If the child has done something that they know is not something that is expected, like hitting, you can discipline the child with putting the child in a timeout, having a timeout chair, having a timeout step that they sit on, and it should be 1 minute for every year they are old. So a 2-year-old would get a timeout for 2 minutes. That is the longest you want to keep that timeout going for. Always look for opportunities to praise good behavior and offer limiting choices. So if you know that the child always gets upset if they don't get juice, you can offer them juice or water. Or if you know that the only choice that you're going to give them is water, you could offer them, do you want the water in the blue cup or the pink cup? Give them choices. Don't offer them choices if a choice does not exist. We don't say, would you like a shot now? And we don't use the word shot either. Okay. So anticipatory guidance. So helping these parents of toddlers, remember, we're helping them anticipate the next stage. So the stage that the child is in right now is called Erickson's autonomy versus shame and doubt. And we're not going to explain this developmental stage to the parents. And we're not going to use those terms in medical jargon, which would confuse them. But we are going to help them understand what it'll take for that child to move through that developmental stage in a healthy way. So the child is really trying to investigate their environment and learn. So again, safety is a huge risk. We want to make sure to teach parents. A lot of 2-year-olds are very good climbers. So don't just put things up high, lock them up. Lock up the cleaning supplies and medications and things that can be dangerous poisons to them. Car safety. The child is still in the back seat, but now at 2 years old, they can face forward. Prevent choking. Anything that is small and hard is a choking hazard. So hot dogs are a big choking hazard. They need to be quartered. So sliced lengthwise and then lengthwise again. Any food should be smaller than the size of the toddler's pinky because that's the size of their airway. So we need it smaller than that so it doesn't occlude their airway if they choke on it. Small carrots, popcorn, nuts are a choking hazard, so we avoid this. Suckers, anything that they can choke on is a hazard. Remember, the 2-year-olds may be going through separation anxiety and may have temper tantrums, and those are expected. Again, going through the different dietary recommendations for the parents, recommending that children sleep in their own crib away from the parent is healthy, and potty training. Kids will be moving through this stage of becoming potty trained, and parents should be encouraged to keep this very positive. Remember, they're going through the stage of shame and doubt, so we do not want to shame them if they're not able to achieve this. Thanks.